Someone once asked me the question if I think that psychiatrists are drug dealers. That's not an easy question to answer because it's kind of like asking, was Dr. Kevorkian, Dr. Jack Kevorkian, was he a murderer? I think so, but I disagree with euthanasia. Other people don't think so, okay? My opinion with psychiatrists and drugs, what makes me make this video? Well, it's becoming more and more in vogue to explore the use of psychedelic microdosing in psychiatry. I am vehemently against this. I think it's a stupid idea. I think it's a dangerous idea. And I think it's important to point out that I am not a doctor, I'm not a nurse, I'm not a physician, I'm not anything, not a medical practitioner of any kind, and this video is made for entertainment purposes only. Let me get into this though. So, what people don't understand, I am a survivor, and I'm going to say this and it's going to sound ridiculous. I am a survivor of psychiatric abuse, pharmacological abuse, forced pharmacological abuse, because as a child I did not have a choice in what was put into my body that distorted my modes of thinking. Okay? Now, there is a lot of evidence that antipsychotics, mind you, I never expressed psychotic symptoms, but was put on antipsychotic medications. So there's a lot of evidence that antipsychotics and antidepressants result in violent behavior, uncontrollable violent behavior, which was a problem, an ongoing problem for me, which has, as an adult, caused me great existential problems. It's made me, in my opinion, I think that is what has caused a lot of my PTSD symptoms, is the harm that I've done to other people while under the influence of psychiatric medicine. And starting to understand, that wasn't me. That was me under the influence of substances that I did not choose to ingest. I'm no longer a violent person. I'm not. However, if anybody met me when I was younger, when I was under the influence of these substances, they certainly would not have believed that. I was quite a different person under the influence of psychiatric substances. My problem with the use of psychedelics is that essentially what it is psychiatry has come to the conclusion that the multitude of garbage that they've been pumping into people over the years does not work. So now they're going to start giving people literal street drugs. Literal street drugs to treat symptoms. I think this is a terrible idea. I do not think it's going to end well. I think that it's going to lead to massive amounts of drug addicts like benzodiazepines have. Benzodiazepines are terrible drugs. And people, what was actually kind of interesting, my family doctor, when I was having the issues with the sinus tachycardia, and my blood pressure was going through the roof, my family doctor wanted to give me benzodiazepines, Xanax to be exact. And when I finally got to a cardiologist that had a brain, he explained to me, if I was taking Xanax, I'd be dead. Because they wouldn't have done anything to treat the underlying heart condition. Okay? This is the problem with the fact that psychiatry is seen as legitimate, not only by psychiatrists, who I think are victims of their own practice. I don't blame psychiatrists. I've worked with psychiatrists. I can tell you firsthand that literally every psychiatrist I worked with really believed in what they were doing, despite the fact that the results were garbage and that their own cognitive dissonance was telling them, oh, this person's getting better, despite the fact that I'm the one going into the field dealing with the person and they're getting nothing but worse. Okay? So my view is clear that, I don't think psychiatrists are drug dealers, at least not knowingly. They're more like drug mules. Okay? they're moving the drug for someone else. They're not really purposely harming people. They think they're helping people. They really do. Some of them don't. Some psychiatrists, none of the ones I worked with, and I want to be clear, despite the fact that I've come out against that organization that I worked for, none of the psychiatrists I worked with were, weird, or none of them, or at least not that I know of, but some psychiatrists, not any of the ones I worked with, do molest their patients, do prescribe drugs in return for certain sexual favors, do prescribe drugs for a price, such as benzodiazepines and amphetamines and things like that, but not the ones I work with. I truly do believe that the majority of psychiatrists are even more so victims of psychiatry than their patients, because I think they really do believe the lies that psychiatric medicine works, and when it really doesn't. And the dangers of these drugs, which will be in the description, please definitely follow the links in the description. And look, read the links, understand what's in those links, because these drugs are dangerous. In my opinion, they're more dangerous than any drug on the street, because at least the drugs on the street are illegal. These are not. Antipsychotics, anti-anxiety drugs, antidepressants, they're all highly, highly dangerous substances that are regularly consumed by people that think they're doing themselves good but aren't, because they're doing it under the direction of a doctor that thinks that they're doing their patient good, but they're not. They're not, and it's clear to see. One of the problems I have is a lot of the therapies that work, like cognitive behavioral therapy and dialectical behavioral therapy, are really the only two therapies that are accepted by most insurance companies. However, hypnotherapy works. It's proven to work. Primal therapy, despite what Dr. Grande says, has a lot of evidence that it works. Okay, logotherapy, which was created by, Viktor Frankl, the guy that survived Auschwitz. Logotherapy works. Logotherapy in a Nutshell is a great book to read. You should read Logotherapy in a Nutshell. My point is that there are multitudes of therapies. The problem with mental health, I do believe, is a medical thing. I don't believe that mental health issues are imaginary. That's the thing that I don't think they're invented. I don't think that they are created out of the fabric or, whatever. I just happen to think that the way that the DSM classifies them is garbage. I think one of the problems that I think is so evil about the mental health industry, and I'm not even sure it's purposely evil. Mental health concerns, and I know this because I have them, and I've worked with people that have them. Mental health concerns are extremely real and extremely damaging, and the ways that are being used to treat them seem to me, from what I've witnessed myself firsthand and what I've seen working in the field, they only seem to be compounded by the therapies and the drug therapies especially, but even the things like cognitive behavioral therapy, they only seem to compound and make worse the mental health symptoms. Okay? I'm not saying that mental health issues don't exist, but I don't think the DSM is a reasonable guide to diagnose people with these things. And I don't think that the treatments that are being received are adequate, let alone helpful. I think one of the important things that needs to be understood with mental health is really where medicine, philosophy, and sociology all intersect into one practice. And it needs to be seen like that. A lot of my problems are an existential crisis, in my opinion, are an existential crisis of me justifying who I am now versus who I was under the influence of these powerful mind-altering substances. Okay? And it is true, like I have a high IQ. I haven't taken a legit IQ test in a long while since I was in grade school, but my IQ was high. It's proven that these drugs can knock back your IQ by up to 20 points, which is good for me because I still had a high enough IQ that my IQ was still at least average. But the point is it's not just the IQ it affects your ability to control yourself. It controls you can't control your body like you should be able to. Excessive sleeping, inability to sleep, drooling on yourself, tardive dyskinesia, which is a permanent issue that can happen from antipsychotics like some of the ones I was on. This is not medicine. This is the pharmacological abuse of the public at the hands of doctors that don't know any better. Okay? I mean, that's what you got. Now, the thing is, if you look at the therapies that work, whether it's logotherapy or whether it's primal therapy or whether it's hypnotherapy, these things work, but these are not what are supported. And I do think that the devil is in the details. I think that the reason that certain forms of talk therapy are favored over, say, hypnotherapy or primal therapy is because they keep the person coming back. And it keeps the insurance companies in business. It keeps everybody in business. It keeps the thing going. It keeps the system going. And I don't think that this system is meant to help people. I really don't. But I do want people, seriously, please look at the resources. And this gets back to why I think it's a really horrible idea to engage in the prescription of psychedelic things like LSD, psilocybin, mushrooms, mescaline, ketamine, these MDMA. These are not drugs that make people mentally well. These are drugs that people go to rehabs to get off of because they've made them mentally unwell. And now they're going to be prescribed and microdosed and all this crap. And I think it's going to be like the benzodiazepines, where we find out it's going to be a much bigger, or the opiates. The opiates are another example of this. But opiates are not a psychiatric drug. But the benzodiazepines, I think benzodiazepines are at least as bad as opiates. They're just downplayed more because everybody's popping a pill here and there to deal with the anxiety. But what they're not talking about is they're not talking about the nutritional inadequacies in the population of people that are mentally ill. They're not talking about the side effects of aggression and violent behavior that's coming out of this. They're not talking about how these are permanently altering people's health statuses, causing heart disease, diabetes. If you look at the side effects of these drugs, you cannot reasonably believe that the benefit outweighs the risk. You can't, especially when there isn't much benefit. You give a psychotic person antipsychotics, they're still psychotic usually. They're just overweight. They're now obese, have heart disease and diabetes, and die early. And they compulsively smoke cigarettes because they have nothing else to do with their life, because they can't get a job, because they can't think. This is not how to treat people. This is ridiculousness. So to answer the question, are psychiatrists drug dealers? No. No, they're not. I don't believe so. I believe that the psychiatrist is the biggest victim of psychiatry. The biggest victim of psychiatric abuse is your everyday psychiatrist that goes to work every day and thinks he's helping his patient by giving them poison. And that's all for this video.